nagre-range po at that time 50 pesos to 120 pesos. Yung merong foam, 30 pesos to 80 pesos. At yung helmet type ay 250 pesos to 350 pesos per piece. And then that's the reason why we have to set an SRP at that time in August. As mentioned po, that was required and set at 26 pesos to 50 pesos. Again, it's a memorandum signed by DOH. Dahil po DOH ang covered po ng DOH itong mga medical devices, and DTI helps them in the monitoring and ensuring that the retail establishment will follow the suggested retail price. But as we all know po, after that, Mr. President, that normalized na ang supply, nakahabol na ang sama na yung importation. We were also able to develop local manufacturers of face masks, even a face shield, and that's the reason why we have already abundant supply of face masks until now, Mr. President. So the prices now are really very low. You would say that it's less than even, I think, less than 5 pesos, anywhere between 2 pesos to 5 pesos. But these are the prices now. After nag-adjust na po yung market, yung supplier, and the same demand continues kasi it continues to be required, but at least po yung supply po natin nakahabol na. So yun po yung history na there were really days and months last year na nag-worsen talaga itong presyo. And it happens worldwide po, Mr. President. Nagkaroon po talaga ng worldwide shortage. That's all, Mr. President.
Mr. Lopez, thank you for the education, for the enlightenment. I would like to call on si Christina Rose Marie Tanda, DBM.
Yes, Mr. President.
Ma'am, sorry. Ma'am, kung kamali pa dito ang DOH, is there any mistake or is there any whatever damage to prejudice to your government interest?
No, Mr. President.
Yes, ma'am. Sorry.
There is no mistake on the part of DOH in terms of the amount they utilized. In fact, the findings of OWA was underutilization of their allotment. Pero as explained earlier po, i-explain ko din further siguro, ang nangyari po, inad yung dalawang bagay na totally unrelated. Yung isa po tinatawag natin na obligation, yung unobligated tsaka undisbursed. Magkaiba po yun. Ngayon dun ho sa transfer naman ng pondo, at that point po, pandemic yun, wala na kung pumapasok sa opisina at that time ng ECP. So I think DOH had no recourse but to transfer the fund to PSDBN at the time. And under the laws naman, talagang pag common use equipment, talaga po sa PS yung ipoprocure by law, kailangan doon sa procurement service.
Yun lang ho, kung may idagdag ka, if you have some advice to the DOH or to us, we would be happy to hear you. But wala naman, then sabihin mo lang na kung ano pang may idagdag mo, then we can excuse you.
Mr. President, just two things that was raised by Secretary Duque earlier about yung kung mga vaccinator at saka po yung pondo para sa doon po sa SRA. Doon po sa SRA, pwede po natin i-release yun mula sa Miscellaneous Personnel Benefits Fund kasi allowance po yun. Ang pangalawa naman po, yung sa vaccinator, part of that, meron kami nakitang 1.6 billion sa DOH pertaining to 2020 na na hindi nila nagamit, na handun lang naman po yun. Pwede nilang gamitin po yun. Tapos yung balansi po nung na kailangan, kasi 3.6 yata ang kailangan nila, pwede po natin kunin sa contingent fund. In fact, parang pa-forward na po, papapunta na po sa inyo para po sa approval, and siguro po hindi naman aabot ng 10 araw yon para matanggap po ng ating mga health workers yung kailangan yung pong allowance ng vaccine.
Well, about
Yun lang
it,
po, Mr.
it's good that you mentioned about the sourcing of the fund.
Yes.
The contingent fund has always been being looked with suspicion. Not
Yes.
only in Congress, but with everybody. Kasi contingent is parang malawak na parang anong gastusin mo. So these are the things that the public never really knew or know na ito is to meet the mga crisis na ganito. Good that we have the contingent fund because we responded to the emergency, which is really an emergency pandemic.
Yes. Yes.
Na sabi ko nga sana to say it again that may order even to Secretary Rodrigo to go ahead and buy without bidding. But to his ano niya, maybe thinking that it would create more problem, binidin niya. Well and good. And nandyan yan. So, ito lang para just to clear up because the people of the right to know what the money.
Yes.
So ito na yung sabi ko nga. Because if you do not, actually, if I did not call you to appear in public, there will always be some, hindi lang some, but many, it will linger on the minds of the people that pinakurakot yung pera. And at this time, pandemic pa, tapos malaman nila itong mga ganito na sa conundrum of Tiono, Maruno. Mabuti marinig na nila. So, I'm happy that you joined us tonight and you can be excused. Maraming salamat.
Maraming po salamat.
Sabi nila, stricta ka daw ma. Acting sa sabi nila. Pero mas mabuti. The stricter you are, the better. Mas malayo tayo sa sakit ng ulo, mas malayo tayo sa kaso, pag stricter tayo. So continue being strict and continue being the protector of the people. Thank you very much.
Maraming salamat po.
Si Yusek Leopoldo, he used to be the director of Davao Medical Hospital. It's now a strategy. But up to this day, tawag ko din Davao Medical Center. And it was during his time that the enterprise improved tremendously. Yung hospital, it can compare with the private hospital in the region. But before magsalita ka, Dr. Vega, just give me one minute. Pwede ano na ako, baka makalimutan ko. Pwede sabi ko, we've been talking about corruption. Alam mo, may bago akong, the name is Edgardo Masongsong. He is the administrator of the National Electrification Administration. I dismissed him from public service. The Presidential Anti-Corruption Commission conducted investigation and gave its recommendation to the Office of President, to the Office of Secretary to dismiss Masongsong from the service. Because PACC conducted investigation and made the recommendation for this dismissal. So, I have approved. This is the nakabagong sa administrator mismo ng National Education Administration. I'm sorry, but I said people are really skeptic and cynic about our desire to improve the government service. We do not claim to maybe really totally clean government at this time, not even with another president or endemic ang corruption. But from time to time, ito, so I'm given the opportunity to show to the people again that we are not bragging about it, but we are trying our best to go back to the situation regarding graft and corruption in our government. Nasingit ko lang ito just to show to the people ethnic corruption kasi ang lumabalabat nito sa buhay. So we have to correct that perception because it will destroy the faith of the people in government. That's one. It's very important. The people must be informed and they must realize that we are working government and we do not accept that saying that it is grassroots. We are trying our very best so far. Certainly itong DOH wala ito. As I explained, I have the same experience. So, it's their job, I know. So, nobody's to do. Pero yun lang sabi ko, dadaanan na isang buti lang yung magulat sa mga record. Yung mga nagdidemanda ng mga municipal mayor tapos ang treasurer at auditor sa gabuhan mahirap, hindi to. They are reduced to tolerate to defend their cases in Sabina because they have to go back. And they expect them to sell their soul to the devil to raise the money just to be there. I said, whenever the case is called and you are not there, you are ordered arrested. And it requires expense. Hotel. Hindi tagal sa Manila, wala kang tirahan. Then you go to the lodging houses. I'm not trying to they're reduced to and then yung mga lodging houses, raffles, this is not really this is not to demean the situation sa tao. Ngayon, last speaker, ikaw na lang muna because you know, apparently you are the right person also to be asked about what has transpired and what are your recommendations with that people. Go ahead, Dr. Bena.
Thank you, Mayor, Maybe, Mr. President, Cabinet members, Senator Bongo. It's a pleasure to be around to all of you. And Mr. President, I'd just like to report to you that the Department of Health has been very steadfast and very consistent in trying to implement Bayanihan 1 and 2 provisions, specifically for this pandemic. It is also good to note, as mentioned by Secretary Duque, that for the Bayanihan 2 extension from January to June, we were already able to give 379,000 healthcare workers for the special risk benefits for. So, for the compensation of the death and sickness benefits, for Bayanihan 2, we have already provided about 23,000 of our healthcare workers. 114 of this have been death and 114 million has been given to them. So all in all, Mr. President, we have been trying really to make sure that the services of the Department of Health will really be felt and be felt by the people in terms of the frontline workers and of course in this pandemic. For the COA report, we take this seriously. The recommendations, we take this as a way of making sure we can improve our services more because this will actually be better for our policy and reforms and fund management. And we all promise to COA that we will, or commit to them, that in 60 days we will give them the necessary documents and the compliance that they need in terms of the implementation, because some of the implementation needed some supporting documents because of this pandemic. And also, we are, Secretary Duque has also mentioned it in this meeting that there is a need for 3.6 billion for the health workers augmentation and to continue the health workers that we hired from January to June. So we must be able to provide them a support again from July up to December. And we would need 3.6 million because 10,500 workers are already positioned across the country as nurses, doctors, medtechs, and so forth. And we will also be adding vaccinators and biosurveillance officers to our list. So that's the reason, Mr. President, that we're asking for this fund so that we will continue with our response for COVID. And also, we have also, the Secretary Duque has also asked and requested DBM for the SRA for specifically for those private healthcare workers who are not able to receive, since some of the hospitals were not able to give their validated list to the regional office, because this is the basis for us to give the necessary allocation to the regions once they have the validated list of those healthcare workers tending to COVID patients. So we're asking them again to provide us the list. We're trying to compile this, and this would lead about 11 or 50 million to make sure that this number of health workers will be able to be provided with the SRA has been given to their other co-workers in the health sector. So that is all, Mr. President, and we are very happy that the DBM has been consistently also supporting us, and the different agencies are all supporting us in terms of our response, because we do believe that our strategy of the PDITR, which is the prevention, detection, isolation, and treatment, is really the only strategy for this COVID-19. There's no other strategy but make sure that we are able to prevent this virus from transmission, and definitely also increase our vaccination. That's all, Mr. President.
Before you go, can you listen to me? This is why COA should be kind enough to understand the situation of the DOH and other departments of the executive department. Alam mo, it's not easy. By the way you narrated that ngayon, we are willing to pay, but you need to have the list and everything. At alam mo, you have to validate it. Ang validation niya, so will be so many thousands. You cannot just come up with a list that's the final in 1 day or 2 days na ito na yun talaga. Kasi ang validation would take, I really do not know how you do it. But I commiserate with your, if you have these shortcomings, I can understand. At ito lang ang tandaan mo. Magkalit-letse man sa buhay, we are just on track, serving the people. At yung ano lang ang kaya natin, kung ano lang ipakita natin sa tao na humanly possible. So, COA, kung they refuse to understand or they understand the situation, I said, give us enough elbow room to move, because it's not, what you're asking is not easy really to come out with. And the second thing, yung utos ko na bayaran lahat, sa mga allowances and whatever. You can source it from everywhere you want. But ito yung you can get it from my contingency fund. And that's the reason why, again, I want to explain to the people na bakit wala sila. Further, I said that I was asking for it because I will use it as a campaign. Wala akong kandidato. Wala kung sino tatakbo. You know, political. But I pity them because they can never be president. These politicians behave the way they are now. I can assure you, they can never be a